Vitamins from A to Z. Vitamin A and the carotenoids. Vitamin A prevents night blindness and other eye problems, as well as some skin disorders, such as acne. It enhances immunity, may help to heal gastrointestinal ulcers, and is needed for the maintenance and repair of epithelial tissue, of which the skin and mucous membranes are composed. It is important in the formation of bones and teeth, aids in fat storage, and protects against colds, flu, and infections of the kidneys, bladder, lungs, and mucous membranes. It guards against heart disease and stroke, and lowers cholesterol levels. A deficiency of vitamin A can cause dry hair and skin dryness of the conjunctiva and cornea, poor growth, and night blindness. Other possible results of vitamin A deficiency include abscesses in the ears, insomnia, fatigue, reproductive difficulties, sinusitis, pneumonia, and frequent colds and other respiratory infections, skin disorders including acne, and weight loss. The carotenoids are a class of compounds related to vitamin A. In some cases that act as precursors of vitamin A, some act as antioxidants or have other important functions. According to recent reports, beta-carotene appears to aid in cancer prevention by scavenging or neutralizing free radicals. One study reported in the Journal of the National Cancer Institute, published in May 2003, found that people who took beta-carotene supplements and who smoked and drank alcohol doubled their risk of precancerous colorectal tumors, while for those who also took the supplements but who didn't smoke or drink, there was a 44% decrease in their risk. Science has not yet discovered all of the carotenoids, although one source documents 600 different carotenoids identified so far. Combinations of carotenoids have been shown to be more beneficial than individual carotenoids taken alone. Taking large amounts of vitamin A, more than 100,000 international units daily over long periods, can be toxic to the body, mainly to the liver. No overdose can occur with beta-carotene, although if you take too much, your skin may turn slightly yellow-orange in color. Beta-carotene does not have the same effect as vitamin A in the body and is not harmful in larger amounts unless your liver cannot convert beta-carotene into vitamin A. People with hypothyroidism often have this problem. It is important to take only natural beta-carotene or a natural carotenoid complex. Betaine is the trade name for a type of carotenoid complex extracted from sea algae. Different manufacturers use it as an ingredient in various products. Sources: vitamin A can be obtained from animal livers, fish liver oils, and green and yellow fruits and vegetables. Foods that contain significant amounts include apricots, asparagus, beet greens, broccoli, cantaloupe, carrots, collards, dandelion greens, dulcish liver and fish liver oil, garlic, kale, mustard greens, papayas, peaches, pumpkin, red peppers, spinach, spirulina, sweet potatoes, Swiss chard, turnip greens, watercress, and yellow squash. It is also present in the following herbs: alfalfa, borage leaves, burdock root, cayenne chickweed, eyebright fennel seed, hops, horsetail, kelp, lemongrass, mullein, nettle, oat straw, paprika, parsley, peppermint, plantain, raspberry leaf, red clover, rose hips, sage, uva ursi, violet leaves, watercress, and geodoc. Comments. Antibiotics, laxatives, and some cholesterol-lowering drugs interfere with the absorption of vitamin A. Cautions. If you have liver disease, do not take a daily dose of over 10,000 international units of vitamin in pill form, nor any amount of cod liver oil. If you are pregnant, do not take more than 10,000 international units of vitamin A daily because of reported problems in fetal development. Children should not take more than 18,000 international units of vitamin A on a daily basis for over 1 month. For most people, beta-carotene is the best source of vitamin A because it is converted by the liver into only the amount of vitamin A that the body actually needs. However, if you have diabetes or hypothyroidism, there is a good possibility your body cannot convert beta-carotene into vitamin A. Consuming large amounts of beta-carotene may therefore place unnecessary stress on your liver. Vitamin B complex. The B vitamins help to maintain the health of the nerves, skin, eyes, hair, liver, and mouth, as well as healthy muscle tone in the gastrointestinal tract and proper brain function. B-complex vitamins act as coenzymes, helping enzymes to react chemically with other substances and are involved in energy production. They may be useful for alleviating depression or anxiety as well. Adequate intake of the B vitamins is very important for elderly people because these nutrients are not as well absorbed as we age. There have even been cases of people diagnosed with Alzheimer's disease whose problems were later found to be due to a deficiency of vitamin B12 plus the B complex. The B vitamins should always be taken together, but up to 2 to 3 times more of one B vitamin than another can be taken for a period of time if needed for a particular disorder. Vitamin bone. Thiamine hydrochloride enhances circulation and assists in blood formation, carbohydrate metabolism, and in the production of hydrochloric acid, which is important for proper digestion. Thiamine also optimizes cognitive activity and brain function. It has a positive effect on energy, growth, normal appetite, and learning capacity. Beriberi, a nervous system disease that is rare in developed nations, is caused by deficiency of thiamine. Other symptoms that can result from thiamine deficiency include constipation, edema, enlarged liver, fatigue, forgetfulness, gastrointestinal disturbances, heart changes, irritability, labored breathing, loss of appetite, muscle atrophy, nervousness, numbness of the hands and feet, pain and sensitivity, poor coordination, tingling sensations, weak and sore muscles, general weakness, and severe weight loss. Benfotiamine is a fat-soluble form of the water-soluble vitamin bone. It is found naturally in small quantities in roasted, crushed garlic, as well as in onions, shallots, and leeks. This enzyme assists in keeping glucose-derived compounds out of healthy vascular blood vessel and nerve cells. The normal supplemental dose is 150 to 600 milligrams per day, taken under the guidance of a doctor or other qualified healthcare practitioner. Sources. The richest food sources of thiamine include brown rice, egg yolks, fish, legumes, liver, peanuts, peas, pork, cold rice, bran, wheat germ, and whole grains. Other sources include asparagus, bruise yeast, broccoli, Brussels sprouts, dulse, kelp, moss nuts, oatmeal, plums, dried prunes, raisins, spirulina, watercress. Herbs that contain thiamine include alfalfa, bladderwrack, burdock root, catnip, cayenne, chamomile, chickweed, eyebright, fennel seed, fenugreek cups, nettle, oat straw, parsley, peppermint, raspberry leaf, red clover, rose hips, sage, yarrow, and yellow dock. Comments. Antibiotics, phenytoin dilantin, a drug used to prevent seizures, sulfur drugs, and oral contraceptives, as well as heavy alcohol or caffeine consumption may decrease thiamine levels in the body. A high carbohydrate diet increases the need for thiamine. Alcoholics are among those most often deficient in thiamine because the alcohol inhibits its storage. Vitamin B2 riboflavin. Riboflavin is necessary for red blood cell formation, antibody production, cell respiration, and growth. It alleviates eye fatigue and is important in the prevention and treatment of cataracts. It aids in the metabolism of carbohydrates, fats, and proteins. Together with vitamin A, it maintains and improves the mucous membranes in the digestive tract. Riboflavin also facilitates the use of oxygen by the tissues of the skin, nails, and hair, eliminates dandruff, and helps the absorption of iron and vitamin B6 pyridoxine.